Hello everyone, my name is Desiree Decker and I'll be here to discuss two musculoskeletal problems. The first being osteopenia and then also osteosarcoma. So to start off with osteopenia, what this is it's a loss of bone mineral density that then weakens your bones. And this is more common in women and women who are over the age of 50. And something I found really interesting is that there is no signs or symptoms, but this actually can be screened through a bone density test. And some people kind of get this confused with osteoporosis and osteopenia, but osteopenia is not as bad as osteoporosis. This affects about 34 million Americans. It can eventually lead to osteoporosis, but isn't always the case. So how this is measured, so your doctor will do a low bone density test. This gives a score called a T-score. And how this is categorized is +1 to -1 is normal, and -1 to -2.5 indicates osteopenia, and -2.5 or lower is considered osteoporosis. Two nursing interventions that I would choose for patients if they were to have osteopenia. So possibly just say our patient was a smoker, definitely advise not to smoke, and also eat a healthy, balanced diet. Fruits, vegetables, calcium, and also your vitamins, which can help. And then also the second musculoskeletal problem that I chose was osteosarcoma, which is a type of bone cancer that begins in the cells that form your bones. So this normally occurs in the long bones, and it also occurs more likely in the legs than the arms. And this is often found in teenagers and young adults. Treatment includes chemotherapy, surgery, and sometimes radiation therapy. So a doctor will choose your treatment based on the size and location of where your bone, the osteosarcoma is at in your bone, and depending on how your cancer has spread as well. So after you have completed treatment, you will have to undergo lifelong monitoring, because since you have cancer, you're more at risk of getting other cancers and also more at risk of getting cancer again than those who have never had cancer. So some symptoms can include swelling your bone or just joint pain that is consistent. It is unknown the cause of osteosarcoma, but the cancer forms when something goes wrong in the cells that are responsible for making your new bone. And just as possibly any other cancer, this can be detected through x-rays, CAT scans, MRIs, and bone scans. And they may also decide to do a biopsy, which is normally the case, to determine the exact type of cancer and also how aggressive and the grade of the cancer is. Some interventions as a nurse is you can, especially children, you can have them make sure they have like their family there and just have some type of outreach, because this would be a very difficult time, especially for young children. So make sure they have support. They can also reach out to support groups. And then also when it comes to your patient, you're going to want to monitor your patient's labs, as this is very important, like their white blood cell count and whatnot. So yeah, the main difference between osteopenia and osteosarcoma is osteopenia is your bone density, whereas osteosarcoma is a bone cancer. So these are two musculoskeletal problems, very different. And yeah, thank you so much.